Well, despite the principal universality that helps guide healthcare across the country, there are millions of Canadians who do not have access to primary care. And in Ontario, it is estimated that roughly 2.5 million people do not have a family doctor. But the provincial government says it is addressing that in part by appointing a former Liberal health minister to connect every Ontarian to a primary care provider within 5 years. Now, that former minister is Dr. Jane Philpott, who I'm happy to say joins us right now. Hello to you, Jane. Dr. Philpott, thank you for joining us.
Always happy to be here.
So the Ontario government has turned to you, giving you this mandate to connect everyone in the province to primary care within 5 years. Luckily, you've written about this in your own book. How closely will you be following the prescription that you laid out in Health for All?
Well, it will be close to the vision that was laid out in Health for All. It was a vision of imagining what it would be like if we were a country that organized ourselves so that every single person in the country would be attached to a family doctor or a primary care clinician, perhaps a nurse practitioner, working in a publicly funded team, someone that they could see in a timely way, and that literally every person in the country knows that they will have a place to go. The front door to the healthcare system would be open to them, almost in the same way that we automatically assign children to public schools in their neighborhood, so that there's never any doubt, there's never any wait, everyone has the access that they need.
So it's interesting because when you wrote this book, you're talking about Canada, but in this case, you'll be using Ontario, I guess, as your test model. But when you talk about those teams and setting them up in every postal code to make sure people do have access like they do to education, it sounds like that would require a lot of money up front. I'm wondering if you've heard anything from the Ontario government as to how open they are to do that.
Well, I've been very open about the fact that it is going to require some upfront investments. Now, I also talk in the book about the fact that countries that have done this have found out that you actually get a great return on the investment. And in fact, countries that have their health system grounded in primary care, they get better health outcomes than we do writ large, and they do so at a cost that is either the same or even less than we pay per capita for their health care. So what we're doing now is actually a very expensive form of care where we leave, as you said, millions of Canadians without access to primary care. They are not having cancer detected at an early stage. They are not having anybody following them for their diabetes or high blood pressure, and then they're ending up with advanced stages of heart disease, strokes, et cetera, which are very expensive to treat. And so investing in primary care will actually pay off and make an more affordable health system.
Mm-hmm. So I guess preventative more than just curative. But you know, I do wonder, though, because it's 2.5 million in Ontario that are estimated to not have a primary care doctor. Is that then your test model? You're going to take these 2.5 million and try to provide it from them and then make the argument that it should be extended province-wide?
Well, it's going to require moving along a few streams at the same time. You know, I think part of it is looking at the capacity that exists already, the family health teams or family doctors that already exist, and many of them are overburdened. We have doctors retiring earlier than they had planned to because they're exhausted and can't get the help that they need. So some of it will be providing supports for those who are already in the system, sometimes adding a nurse or a nurse practitioner to a group of doctors so that they can take on more patients. But it will involve, in other cases, adding entirely new primary care teams where they don't currently exist, in communities where there are sometimes tens of thousands of people who don't have access to primary care. And we'll have to follow down those two paths at the same time to make sure that we maintain what we've got, retain the capacity in the system, and then add new capacity.
Mm-hmm. Now, again, the mandate that's been given to you by the Ontario Premier, it's a 5-year mandate. Is that enough runway to make the model that you are envisioning happen?
I think it's a reasonable runway. I have the sense that once we get this started, people are going to be actually quite impatient because they will see that their neighbors are getting access to care and they don't have it. So there will be an urgency that will naturally bubble up as people start to see some hope for the healthcare system. And so we'll try to do this as quickly as we can. Having said that, there are some things that you can't do overnight. I mean, you can't train a doctor overnight. It takes time to get through medical school and family medicine training. It takes time sometimes to build new clinics and make sure that they're outfitted properly. And even just to do the design and planning will take a little while. So, I'd like to do it as quickly as we can, but certainly I think it's quite doable within the time frame that the government has suggested.
Even for smaller communities? Because I know, for example, there are long waiting lists for doctors when you talk about suburban areas, urban areas that have been feeling these huge population growths, but the remote areas, smaller communities like a Blind River or a Wawa in Ontario, how do you ensure that they also benefit from this model?
Well, I don't think we can use the excuse that just because a community is smaller or more remote, that it somehow shouldn't get access to the care that every Canadian deserves. And so there'll have to be a bit more creativity in some of those cases. In some cases, these are the places where we may have to use more in the way of nurse practitioners to be able to work in teams, supporting a few family doctors to be able to make it possible. In some cases, although, you need to periodically see people face to face, and there are certain medical conditions for which the care has to be face to face. But in more remote areas, there's a greater opportunity now for virtual care to be able to fill some of those gaps. But we don't say to children who live in these small communities, well, we're not going to send you to school because you live too far away. We have, as a society, decided that every child should have access to a public school. So we need to have that same determination and commitment when it comes to access to primary care.
Mm-hmm. Now, you and I have talked about your book earlier, and I do wonder, because at the time you said you're willing to work with any government. This is not a partisan issue for you. And here you have a progressive conservative premier turning to you, a former Liberal cabinet minister. But Ontario is slated to have its next election in June of 2026. There's speculation that the premier may actually call one earlier. How would those political considerations, determined by others, not you, affect your mandate?
Well, my role is within the Ontario Public Service, so it will proceed regardless of who's in the government. And you're quite right that this is not something that Canadians want us to use for partisan purposes. This is something that should be a fundamental obligation of government to deliver this kind of care for the people of Ontario. So I hope that regardless of what happens in politics, that I've been given this mandate to work with the public service to make it happen, and that's what I'm determined to do.
Okay, so that's the political. I'm going to ask you something personal now, because few people get the opportunity to put down in paper, in a book, their ideas to solve the healthcare crisis, and yet you did, and now you actually have the chance to try to make your political theories work in reality. How daunting is that?
Well, it's daunting, but it's also quite exciting. I mean, it's been a dream, not just of me, but of many of my colleagues, to imagine that we could redesign the way that we deliver healthcare, that we would find the support of government to be able to design and deliver a system of universal access to primary care. And now I've been given the tools or the reins to be able to do that. So it's a pretty exciting prospect, and I'm really looking forward to getting started.
Well, I look forward to speaking with you in future to see how things are going. But for now, Dr. Jane Philpott, thank you for the time.
Thanks for having me.